Absolutely. I think that's a great way to look at it, because it is really crisis management. And I think that what one has to reflect on when one first experiences a circumstance like this is first recognize it immediately and identify the protocol that you wish to engage so as not to make matters worse. It was fascinating because when we, for example, the first presentation was focused on the development of a coronary artery dissection. And I think the natural reflex when one sees something that is happening in a procedure that is an adverse event, one wants to characterize it and say, what's going on? What do I need to do? And one of the worst things you can do when there's a coronary artery dissection is continue to take pictures of that artery by injecting contrast into the vessel, because the mere act of injecting the contrast in the first place may have been what caused the dissection, and if you keep on doing it, you will just propagate that dissection and make it worse and lead to a further adverse outcome for the patient. So what we have to do, and this is a very specific example, but to abstract that learning is to say, rather than keep on doing or looking or checking or testing, we have to implement immediately our emergency protocol. And that likely is first to recognize it and to announce that this is going on to all the members of the cardiovascular team, number one. Number two, it's to share the experience of all members of the team in real time to say, here's what we need to do. And often it takes fast action to help to salvage what's going on or to protect from things getting any worse or to stabilize the patient, and to implement really in parallel rather than in series, so everybody's kind of working towards the same cause and same outcome, our emergency procedures to help. Then at the end, once hopefully the patient has been stabilized, at least with a temporary method, to think about the more permanent solution. For example, in a case of a perforation, it may be to seal that part of the artery by immediately inflating an angioplasty balloon at the site that is perforated. Take a moment to think about what equipment do we have in the lab, what else can we do, what do we want to do with the individual's systemic anticoagulation program, and to take stock of how to resuscitate the patient in that circumstance, and then to move forward with a more durable and permanent solution. And then finally, after the fact, to debrief. And this involves all members of the cardiovascular team to share from their wisdom. Often, at most institutions, there will be a morbidity and mortality conference where the shared reflections of all operators and all clinicians and all members of the cardiovascular team would be derived at that time, and really then to develop a plan for how to prevent these events from occurring in the future and how to treat them where they do occur.